Hi guys, Rob from Go Performance here. So this is part 2 of the video on bone stress injuries. So in my last video I gave you an introduction about BSIs, what they involve, what they included. We talked about stress response, we talked about bone strains and stress fractures. So now we're going to explore stress fractures in a bit more depth and how to kind of manage those. So stress fractures are divided into what are called high risk and low risk categories. Risk can relate to factors such as location and also severity of the stress fracture as well. High risk fractures tend to be on what we call the tensile side of a bone. So if you imagine kind of bending a stick until it snaps, you'd expect that curved edge to be the side that snaps first, and that's the tensile side. So high risk sites also tend to have low blood supply, which obviously slows down the healing process. And it might be somewhere such as the 5th metatarsal, which is kind of part of the bone closest to your ankle on the outside of your foot. Stress fractures at high risk sites can take 5+ months to allow the athlete to return to running. So it is quite a long journey for that athlete. Low risk sites tend to respond really well to modification of load and activities. So it might be that you can do things like pool-based running, cycling, so off-feet conditioning, and if you're lucky enough you could use, for example, an anti-gravity treadmill, which you can change the body weight that you're actually putting through your lower body. An example of a low risk injury site might be the posterior medial tibia, and this is due to more kind of compressive forces that are experienced at this site, which actually kind of aids and promotes better blood supply. So the bone's being squeezed as opposed to pulled apart in that location. An injury in an area such as this might allow the athlete to return to running in as little as 6 weeks. It's all on an individual basis. As mentioned previously, female athletes are at high risk of BSIs, and this is possibly due to factors such as lower bone density or size, differences in gait, and other biomechanical differences during running. Other predictors of stress fractures in female athletes include delayed age of their first period and even their reduced calf girth as well can be a factor. Other reports have stated a link between stress fractures and relative energy deficiency in sports, or REDS for short, particularly in female endurance runners. Nutritional factors also come into play, so vitamin D deficiency is a big one and can lead to a BSI risk, and this is often linked to a lack of sunlight exposure. Increased risk from biomechanical factors might include things like higher ground reaction forces when you're running, more knee stiffness at impact, rear foot striking, subtalar pronation, rear foot supination or eversion rather, gluteal dysfunction, lack of ankle dorsiflexion. So these are all kind of factors that can come into play when it comes to increased risk of bone stress fractures or injuries. So how do we manage these types of injuries? That's the important question. So it's important to take an holistic approach to manage BSIs. We need to consider modifying training load. We need to look at if there needs to be a modification of technique, so we can look at those biomechanical factors that we've mentioned earlier. Nutritional modification, so it might be that we need vitamin D supplementation, especially if you live in a particularly dark and cloudy climate, and potentially psychological interventions as well. If we want to maximise the osteogenic effect or bone formation during this healing process, we could consider using short bouts of appropriately intense activities, such as S&C work or even running if they're ready to progress onto that. And this is separated by rest intervals, so we're kind of maximising that stimulus, but also allowing the time for the bone to recover and heal. And we're trying to avoid that prolonged mechanical loading, which might have been a factor in the injury starting in the first place. Low risk stress fractures, most can be managed, as I mentioned, with activity restriction and then gradual return to normal activities. So you might start with off-feet conditioning, pull-based running, anti-gravity treadmill, and then a gradual return to running and a gradual increase in that running volume, which is really important. You don't want to jump straight back in with the usual distances that you've been running. It needs to be modified appropriately. So phase 1, we're looking at pain control. We want to try and avoid using anti-inflammatory drugs, so things like ibuprofen would be something you might want to avoid because it actually delays or could delay the bone healing process. If it's a lower body injury, lower body stress fracture, we might have temporary discontinuation or modification of activities. So you might have to go on crutches, you might have to use a walker boot, especially in high risk stress fractures. Weight bearing activities are possible for daily activities in maybe low stress fractures or low risk category stress fractures. If it's an upper body stress fracture, obviously we want to avoid any high load going through that upper body. But the important thing is all of the above that I've mentioned in phase 1 needs to be considered, so it allows the bone to heal and prevents any further damage to the site. Phase 2, so this usually begins when the athlete has been kind of pain-free for 10 to 14 days. We usually say 1 week after the athlete has experienced any kind of bone tenderness, we can resume loading approximately kind of half the usual intensity. So really reducing that volume. For a runner, it might be that you just stick into slow, steady runs at a reduced volume and intensity. The recommendations say that we can use increments of up to 25% in training load over a 3 to 6 week period under close supervision. So we need to see if there's any kind of pain response. If there is any kind of pain response from the activities, we need to obviously back off, reduce the volume, reduce the intensity until the athlete can gradually increase that running volume again. We can reintroduce S&C loading at this point. So we might do things like bilateral bodyweight squats or bilateral bodyweight RDLs or hamstring work, posterior chain work. But then others might be able to do loading as well earlier, and that just depends on the kind of factors such as the severity of the injury, the location of the injury, and also the training history of that individual athlete. High risk sites, these are more complex and may require kind of a specialist team to help manage them. So you might involve a sports physician, an orthopedic surgeon involved. Grade 1 and 2 high risk stress fractures can be resolved with conservative management. We certainly need to consider using restriction of weight bearing activities, so it might be that we are on crutches and a boot until scans have confirmed that the healing's completed. To prevent full fracture and further complications, we need to, as I mentioned, we need to have that confirmation of full healing from a rescan in the area around the injury site, so we know that your bone is ready to begin kind of taking on higher intensity and higher volume activities. A site of the fracture, the higher grade of the fracture, the stage of the healing may determine whether or not that individual needs to have surgery, which is kind of one of the last resorts really. Overall, a kind of comprehensive program needs to be utilise with the athlete to maximise their recovery. It needs to include S&C, it needs to include your endurance, your flexibility, your mobility, of all the lower limb musculature if you've got an injury there, and reconditioning of the kinetic chain. So we're not just focusing on one particular area, we're kind of tying it all together as well, making sure the athlete's ready to perform back to a similar level from before. This ideally is going to be managed by a multidisciplinary team. So you might involve the S&C coach, your physio, your sports physician potentially, your technical coach, so like running coach, nutritionist, psychologist, people like this, all working together so that we are maximising the athlete's potential for recovery. Okay guys, so that is an overview of how we might manage and deal with stress fractures. In future videos, I'm going to be doing more on injuries and also technique for certain lifts, so keep an eye out for those. Okay, any questions, just give me a shout and I'll speak soon. Thanks guys.